This is TTT Live. I'm Mahalia Joseph Wharton. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, Suite 100.1 FM, Next 99.1 FM, and on Facebook at TTT Live Online. We go now to Senior Corporate Communications Officer at the Ministry of Health, Al Alexander.
Good morning. We are pleased to have you back with us for this virtual media conference by the Ministry of Health, as we seek to keep you informed of the national COVID-19 response. Here to discuss the latest COVID-19 updates with us are Dr. Miriam Richards, Principal Medical Officer, Ministry of Health, Ms. Salisha Baksh, Acting Chief Executive Officer of the Northwest Regional Health Authority, Mrs. Sherma Alexander Campbell, General Manager Nursing, also of the Northwest Regional Health Authority. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and I will be your moderator this morning. Dr. Richards will present today's clinical update.
Thank you very much, Al. To CEO Bash from the Northwest Regional Health Authority and our Primary Care Nurse Manager, Mrs. Alexander. Good morning to members of the media. Once again, thank you very much for your continued attendance at these media conferences, which really serve to provide transparent and up-to-date information to members of the population. Good morning, Trinidad and Tobago. Thank you for joining us. This morning, I'd like to present the clinical update as of 4 p.m. on April 11, 2021, and as per Media Release 691. Also, I'd like to present an update on the epidemiological status, that is the rolling average number of cases over the last 7-day period, a repatriation update including information on returning nationals from St. Vincent and the Grenadines, and information on our vaccination drive. Ms. Basha will provide details of vaccination drives in the Northwest RHA and operational improvements. As of 4 p.m. on April 11, 2021, there were an additional 22 cases of COVID-19 that were confirmed. This takes the total number of active positive cases to 518. These 518 cases are divided as follows. 8 persons are in step-down facilities, and specifically this is the day-based step-down facility, and 62 persons are hospitalized. Of the 62 persons, there are 19 persons at the Scarborough Regional Hospital who are all at ward level. There are 4 persons at the Cora Hospital, and there are 39 persons broken down at the Couva Hospital, broken down into 33 ward level patients, 5 ICU patients, and 1 HDU patient. We also have 426 persons who are in self-isolation. That is, they are COVID positive but are well enough to be monitored in a home environment once they have the appropriate socioeconomic conditions in terms of spacing. We have seen a gradual increasing trend in terms of hospital occupancies based on the increasing rolling average. Up until about 4 to 5 weeks ago, the rolling average was in the vicinity of 4 cases per 7-day average. However, of course, we've been seeing an increasing trend where the rolling average is now actually 32. And this has been one of the highest rolling averages since last year. Currently, we are in what is called epidemiological week 15, which is how the Ministry of Health monitors the number of cases. And at present, our hospital occupancy levels have increased from 2% up until week 11 or so to now 18%. We are also seeing an increase in the ICU occupancy, again from 2 to 5% up until week 11 to this morning up to 20%. This sort of increase underscores the need for members of the population to continue practicing COVID-19 mitigation measures because it demonstrates that the increasing cases which are being spread by community transmission are really leading to increased hospital occupancy rates. I'd just like to speak a bit about repatriation exercises. As of this morning, there are 259 persons who are in state and state-supervised quarantine, as well as persons who are quarantining on board vessels in the oil and gas sector. Tomorrow, we have a planned repatriation exercise for 40 returning nationals that's been organized by the Ministry of National Security, and they are expected to return on the Galleon's Passage. I'm pleased to report that the Ministry of National Security and the Ministry of Health continue to collaborate, and that all arrangements with respect to transfer logistics, quarantine facilities are in place and have been confirmed. We have another exercise on April 14th with persons who are returning from Canada. We have approval, given approval through the Ministry of National Security for approximately 140 persons. There's a planned exercise on April 16th from Barbados. Of course, we are monitoring the situation with the volcanic ash from the Mont Soufriere eruption in St. Vincent and the Grenadines prior to really continuing or confirming this activity. However, all arrangements are in place once this activity is confirmed, even at a later date. There's a planned exercise on April 21st from Miami, again with an approval number of 140. What we've been seeing over the last 2 to 3 months is really a 90% acceptance in terms of the approvals that are being given out, and we have really tried to guarantee the safe, comfortable, and effective return of all our returning nationals abroad. Once again, we would like to thank our returning nationals and their families as we endeavor to keep Trinidad and Tobago safe. At present, and based on statistics provided from 21 vaccination sites across 5 regional health authorities in Trinidad and Tobago, we have vaccinated 7,146 persons. The Ministry of Health would like to recommend and to advise members of the population that vaccination is just an additional layer of protection based on COVID-19 measures that are in place. Even if you are vaccinated, we are asking you to practice the 3 W's. Wear your mask properly, watch your distance, and wash your hands. Vaccination, again, is just an additional layer of protection, and we continue to ask members of the population to exercise personal responsibility daily in order to protect themselves, their families, their co-workers, and their population. Please desist from commingling, because we are seeing a high rate of community transmission that's been the highest over the last 15 weeks or so. So let's try to reduce mixing unnecessarily, and let's please continue to practice the 3 W's. Thank you very much, Al.
Great advice, Dr. Richards. Thank you very much. Continuing with our series featuring CEOs of the Regional Health Authority, we are pleased to have here with us Ms. Salisha Baksh, who will update us on the COVID-19 vaccination rollout in the NWRHA. Ms. Baksh?
Hi, good morning. Thank you, Mr. Alexander, Dr. Miriam Richards, Principal Medical Officer, Ms. Shilma Campbell, JM Nursing of NWRHA. Good morning to the members of the viewing and listening public and the media personnel. Thank you for the opportunity this morning to share the Northwest Regional Health Authority's vaccination rollout plan and our operational issues and mitigation strategies that we have developed. As we all know, the vaccination rollout plan began on Tuesday. And at the NWRHA, we have 2 vaccination sites, 1 per each of our counties. So in our St. George Central County, the Barataria Health Center has been designated as a vaccination site. And in our St. George West County, the Diego Martin Health Center has been designated as a vaccination site. Since the beginning of the vaccination rollout plan, we have seen a great increase in the acceptance of the vaccines, and this has resulted in the high level of number of walk-ins we have seen at both health centers. So just to give you a brief snapshot of the type of walk-ins we have experienced and seen at both health centers, at the Barataria Health Center, on the first day of the vaccination rollout, we would have registered 120 walk-ins. On Wednesday, 89 persons would have been registered. On Thursday, 48, and on Friday, 42. So for the first week of the rollout plan, we had a total of 299 walk-ins registered at the Barataria Health Center. At the Diego Martin Health Center, there was a very much high increase in the user acceptance and interest in vaccinations, and it being a dense population, the Diego Martin area and environs, we saw a very high turnout of persons wanting to register and wanting to get their COVID-19 vaccines. On day one, we were able to register 548 persons. On day two, which was Wednesday, 763 persons showed up at the health center to be registered. On day three, which was the Thursday, 465, and on Friday, 285. So for the first week, the total number of walk-ins that were registered at the Diego Martin Health Center were 2,061 persons. Both on day one, which was the Tuesday, and the Wednesday, we did experience these high numbers. And of course, there were crowds that we had to use our human resources to try and disperse as quickly as we can. And those high numbers continued during the week. And when the team met, we understood the challenges facing the persons who were registering these large numbers, and we took a decision to increase the number of employees who would be registering, so at least persons could have been registered in a quicker way, and the crowds would have been dispersed in a quicker manner as well too. With respect to our telephone lines, at the beginning of the rollout plan as well, we would have commenced with one line. And of course, we were inundated with calls on that day. And by the afternoon, we would have expanded our telephone lines to 3 lines. Unfortunately, we were still inundated with calls by day 2, which was the Wednesday. And the executive team took a decision to double the capacity of our telephone lines, and we expanded from 3 to 6 lines. We still are experiencing a number of calls, and with respect to the new initiative going to be launched by the Ministry of Health today with an additional appointment system, we are expecting that there will be greater accessibility for the members of the Northwest population to be able to get their appointments, be it via the call lines or the new appointment system that the ministry will be rolling out from today. Additionally, with respect to the number of persons vaccinated, as indicated before, there has been a higher level of vaccine acceptance in the Diego Martin and environs area, and we saw a larger number of persons wanting to be vaccinated. And in so doing, the Northwest Regional Health Authority took a decision to pilot an initiative on Saturday, which occurred this Saturday actually, where we decided to arrange for a mass vaccination exercise because of the high number of persons that are interested and wanting to get their vaccines. So we partnered with the Defense Force, the medical team of the Defense Force, and we were able to vaccinate a very large number on Saturday. We were there from 8 a.m. till about 7 p.m. We were targeting 300 of our patients, NCD. 75% would have been NCD patients who would have been registered, as well as 25% would have been the non-NCD persons who met the criteria and would have been registered via the walk-in process, etc. As I said before, the target was 300 persons, and due to the tireless efforts of the staff, we were able to vaccinate 502 persons, because throughout the day we did have walk-ins showing up at the health center, and instead of turning them away, we did accept them and did vaccinate them. And many of the walk-ins who did turn up would have been persons who would have been registered during the week via the walk-in system or via the calls. And we were very pleased with the success of the exercise. It was well coordinated. The Defense Force played a vital role in making sure everything was managed and that the operations were smooth. There were no long waiting times, and the smooth process really contributed to our ability to vaccinate more than the 300 persons that we were initially targeting. And, I must say an immense thank you to the Defense Force and the medical team. In recognition of this higher acceptance of the vaccines, we have also taken a decision to increase our vaccination sites. We are going to double the number of sites that we presently have. So we are going to have the Morva Health Center be designated as a vaccination site. That should be up and running by tomorrow. And we will be vaccinating our NCD patients on Wednesday, which is the designated NCD clinic day. We are also taking a decision to add an additional vaccination site in our St. George West County, which is densely populated as indicated before. And the Carenage Health Center has been earmarked to be that vaccination site. We are still working out the logistical issues with respect to that, and we should be having that site up and running within the shortest period of time, and I'm anticipating that it happens before the end of the week. The exact date of commencement of vaccination services at that health center will be issued to the members of the public at large once that date has been finalized and the logistical issues have been resolved. I just want to mention that, the vaccination rollout, there were teething issues with the Northwest Regional Health Authority, and the vaccination team, we met every afternoon at the end of every day to review the activities, the daily activities, identify what the challenges were, and develop mitigation strategies to remedy those shortcomings which would have been identified. It's a learning process, and we are committed to every day trying to see how we can make the process smoother. In so doing, we will be expediting our appointment system process. We have increased our human resource capacity with respect to that, and we will be rolling that out as of today. And we are hoping that as we go from day to day, we continue to implement different initiatives to ensure that the members of our public and our catchment area are able to get their vaccines and are able to access their COVID-19 vaccines in our fight against the COVID-19 virus. And that's the end of my update for this morning.
Thank you very much, Ms. Bash. Mrs. Schumer Alexander Campbell, General Manager, Nursing, will give us some additional information specific to the vaccination locations across the NWRHA.
Thank you very much, Mr. Alexander. Good morning to Dr. Richards, PMOI, Ms. Bash, CEO, acting at Northwest Regional Health Authority, members of the public, members of the media. Thank you very much for the opportunity to give some additional information. At Northwest Regional Health Authority, we received our vaccines on the 4th of April, and our vaccine program was initiated on the 6th of April. I want to first of all say thank you very much to the staff at Northwest Regional Health Authority who have been working assiduously to vaccinate all those who are interested in being vaccinated. We are seeing great teamwork from the Northwest family. Prior to receiving the vaccines, we asked our staff to indicate their interest in being vaccinated. About 650 staff members did so. Since the rollout began, we have been seeing a steady increase in the number of staff who are expressing an interest in being vaccinated. So far, we have vaccinated over 200 Northwest staff. Patients who are currently registered in our NCD clinics will have either received their vaccines, already received an appointment, or will do so within the next few days. So far, we have approximately 450 patients who are registered in our NCD clinics, indicating that they are interested in receiving vaccines. These patients will be contacted within the next few days. So far, we have vaccinated over 500 patients who are registered within our NCD clinics. We have seen a great response from the public, as CEO Bash would have said just a few moments ago, who are expressing an interest in being vaccinated, especially those within the Diego Martin Health Centre and environs. Our initial plan was to concentrate in week 1 on our healthcare workers, as this was a first opportunity for Northwest Regional Health Authority to vaccinate our staff. We are pleased that we have vaccinated over 300 healthcare workers who operate and work within the region that Northwest covers. However, due to the health-seeking behavior of the people that we serve, we have actually doubled those who have been vaccinated of non-healthcare workers. As CEO would have indicated, we have seen long lines at Diego Martin Health Centres. At the end of each day, we held operational review meetings where we looked at our current process and any challenges that we would have had. This enabled us to implement strategies to improve our efficiency. To this end, we have increased the number of administrative staff serving members of the public who are choosing to register in person. We've increased the number of phone lines as well as the staff who are attending to those calls. In conjunction with the Ministry of Health, we have identified 2 additional health centres which will be coming on stream in the very near future. As a result of these steps, we have seen a reduction in the number of people in the lines, the length of time those people are waiting in the lines, and crucially, a day-on-day increase in the number of people who are being vaccinated. I want to take a few moments to let the public know how they can manage side effects they may be experiencing as a result of receiving the vaccine. Some expected symptoms may include redness at the site, swelling, fever, chills, headache, nausea, and even some muscle pain. These symptoms should last for 24 to 48 hours. Drink plenty of fluids, rest, and use paracetamol as indicated. If these symptoms persist, you develop any unexpected symptoms, please seek advice from your regular doctor or visit your local health centre. Remember, continue to wear your mask, watch your distance, avoid crowds and keep 6 feet apart, and of course, wash your hands. At Northwest Regional Health Authority, we are committed to vaccinate all individuals who are interested as we seek to continue our fight of COVID-19. I take you back to Mr. Alexander. Thank you very much.
Thank you very much, Mrs. Alexander Campbell. Our question and answer segment is up next. I would like to ask our media representatives to begin by stating your name and the name of the media house that you represent before you put forward your questions to our panelists. As a result of time limitations, we are permitting no more than 2 questions per media house in the first instance, and if we can, we will allow one additional question from the media representatives. We now go to CL Communications.
Good morning, everyone. Natalie Singh, CL Communications. I got this question from a member of the public, and I thought I'd bring it to the panel. The person is over 60 years old with comorbidities. They approached the Barataria Health Clinic to be vaccinated. And the people there are saying that they're only giving the frontline workers the vaccines first, and then others will come after that. I was just wondering if you can, are you aware of this? And can you clarify this for me? Isn't it supposed to be the two groups in tandem as long as you put your name or you sign up for to be vaccinated? Secondly, are all centers following the procedures when it comes to the rules which you have set down on how the centers have to operate? Thank you.
Ms. Bash, could you take
Sure.
a few
Hi,
questions?
good morning. Yes, both the healthcare workers as well as our NCD patients, as well as the members of the public who are not part of the NCD clinics but do meet the criteria, are all to be vaccinated, and it will be done in tandem with one another. I am not sure what information was given to this particular person, but I am sure that their names and contact number would have been taken to have been registered. But we will follow up with the Barataria Health Center, but it will be done in tandem with each other, those three groups that I just listed out.
Thank you very much. We now go to TTT.
Good morning, everyone. Kimberly D'Souza from TTT News. Just a point of clarification, Dr. Richards. The number of people returning on the Galleon's passage, is it 14 or 40? And I'm not sure if you gave a number for the Barbados repatriation exercise. Can I also get a number for that, please? Thanks.
Thanks a lot, Mrs. Souza. The number that is estimated to return on the Galleon's passage is anywhere between 30 and 40. We are about to receive confirmation, possibly within the next 2 hours, from the Ministry of National Security. But we have prepared our logistics exercise and state quarantine facility for a maximum number of 40, and we can actually accommodate even more. The approval number for the Barbados repatriation exercise continues to be approximately 140. Of course, that number will have an acceptance rate based on persons who are ticketed. And the ticketing process, we give the persons a timeline, or I should say CAL gives the persons a timeline of just about 24 hours prior to the flight. Of course, we are monitoring the situation with regards to the volcanic ash in St. Vincent and the Grenadines, which may affect flights from Barbados to Trinidad and Tobago. Thank you.
Thank you very much. We now go to Newsday. Newsday, we are ready to take your call.
Good morning, everyone. Rihanna McKenzie here from Newsday. I would just like some clarification, if possible, on the process for the phone line, because as you indicated, there were some issues there, people complaining that they weren't getting through, or in one instance, one patient said that he was asked to come in to the center to register. Now, you said you double the phone lines, but can those using the phone lines now successfully register over the phone without having to come in and fill out this form, which is what this patient told me was happening? Second question, what is the progress of the online registration mentioned some time ago? When will that be up and running? Thank you.
Hi, good morning. Thanks again. With respect to the phone lines, the message has always been that they can register via the phone lines. The persons who are answering the phone lines take the patient's name, contact information, address, medical conditions, and indicate to the person calling in that they will receive a call with their appointment date. It has never been an instance where we inform the members of the public calling in that they have to visit the health center to sign up the form. That has never been the message. So I'm not sure about that, the accuracy of that particular information. Thank you.
Thank you very much, Ms. Bash. We now go to Wired 868.
Good morning, Fiona Boxer, Wired 868. I don't think you answered the second question from the previous report.
Okay.
I'm just going to re-ask
Wired
it.
868.
Give an update about
We are not hearing you
the,
quite. Hello?
Yes?
We're not hearing you quite clearly. Could you raise your volume, please? Thank you.
Is this any better?
Yes.
Is this any better?
Much better, thank you.
Okay. So the question was about the online system. Can you tell us an update about when that would be online, when I would come on stream? So that's the first question. And my second question is for whether or not there's a way to detect whether people are making multiple appointments in an attempt to save a spot, and what's being done to either prevent that or to respond to that.
Okay, good morning. I'd like to take that question, but before I take that question, I'd like to reiterate the need for persons to follow all COVID-19 prevention measures. This is in light of information that we received today of another case, or the second case of the UK variant B117 from a repatriated national from the United States. This person is currently receiving medical care in the parallel healthcare system and is isolated. But again, we would like to remind the population and Trinidad and Tobago of this second case of the new variant. I'm just moving across to the question regarding the online system. And this online system should be in order by the end of this week. We've also instituted a WhatsApp system, so persons are not going to be put on hold, and that information will be provided by the relevant RHAs. So thank you very much, Ms. Bostic, for this question. And once again, a warning to all members of the population about this new development regarding the UK variant B117. Thank you very much.
And thank you very much, Dr. Richards. We now go to Radio Tambourine. Radio Tambourine, we are ready for you. Okay, we are not hearing. Please check your volume. We are not hearing. Please check your volume.
Are you hearing me? Are you hearing me?
Okay.
Hello?
All right. Please ask your question. We are hearing you now. Please go ahead.
Right. My question is any sort of review or analysis of the Easter activities, re-travel, interaction, any sort of update on, based on the Easter travels and activities, an update on that in terms of increases, in terms of infections, etc.
Do you have a second question? Do you have a second question? Okay. Dr. Richards?
Thank you, Mr. Clark. What we are seeing is a continued rise in terms of the number of cases of COVID-19. Whether it's linked directly to the Easter holiday is really still being analyzed, because we would really see an increase in those cases, let's say, for example, 10 days or so after the completion of the Easter weekend. But what I can say affirmatively is that there is community transmission that is now throughout Trinidad and Tobago. So we are seeing now an increase in cases on the east-west corridor, as opposed to originally where there were increased cases in Caroni and Victoria and St. Patrick. So thank you very much for your question.
Thanks again, Dr. Richards. We will take the questions from CNC3 now.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. My two questions this morning, I believe, would be for Dr. Abdul Richards. I believe that we were supposed to receive some 40,000 doses of Oxford AstraZeneca from India today. Is that what? Could you give us any more details about when that is going to arrive, if it has already arrived, how it's going to be incorporated into the national vaccination drive? And my second question is, I don't know if you'd be able to answer this one, is on the Gavi website, it has Trinidad and Tobago listed as receiving 34,000 doses of vaccines. But I mean, locally, we've been given information from the Ministry of Health that it's 33,600 doses.
Okay, thanks very much, Richard, for the two questions. Regarding the importation of the 40,000 AstraZeneca vaccines from India, we have not received those vaccines as yet, but the actual importation date has been delayed due to extenuating circumstances or circumstances that are beyond our control. The Ministry of Health will provide updates once a confirmed date is given. The question regarding the 34,000 doses on the Gavi website and the actual receipt of the 33,600 doses, that confirmation again would come from the Ministry of Health. So thank you very much.
And thank you again, Dr. Richards. We now go to TV6. TV6, we are ready for your question.
Hello, good morning. Vanessa Cutting, TV6 News. To Ms. Baksh, I noted that you said about 25% of the persons who were vaccinated in this mass vaccination drive would not have had NCDs. And I'm wondering, given that the ministry's policy was that members of the general public would be vaccinated in phase 4, I believe, what was the communication with the ministry about vaccinating persons without NCDs and persons who are not elderly? If there was any communication on that, and if so, if the policy has changed and other RHAs may also be just vaccinating members of the general public. And also on that same note, is it that this RHA was given an increase in the number of vaccines that they received, and is it that the ministry has decided to go ahead and use all of the vaccines on the first dose as opposed to holding some for the second dose?
Hi, thank you for your question. Actually, let me clarify what I said. I said with our mass vaccination program, our target was 300 persons. 75% would have been our NCD patients who would have been pre-registered, and 25% would have been persons who were not part of the NCD clinic but met the criteria, meaning over 60 with comorbidities. And that was the target. And that was the proportionality between the 300 target of persons. And what I did say as well too is that we went beyond our target because we did receive walk-ins on that day, and persons who would have met the criteria who were walk-ins would have been vaccinated as well, and we exceeded the target from 300 to 502 persons were vaccinated on Saturday. We met the criteria, and all persons who were vaccinated would have met the criteria as of the first phase as identified by the Ministry of Health. Thank you.
Thank you very much, Ms. Bash. We now go to a follow-up question by Wired 868.
Yes, sorry. This is the second question from my last time speaking. I was just wondering if there were any measures in place to prevent people from making multiple appointments at different locations or gumming up the system in any way like that.
Thank you very much. Ms. Bash, could you assist with that question?
Sure. As indicated before, we would have increased our lines from 1 to 3 and then to 6, and we will be increasing our manpower as it relates to calling back persons to give them their appointment dates, and that is being rolled out today because we are increasing our human resource capacity in that regard. And with respect to what Dr. Richards would have indicated with the WhatsApp appointment system, That would be rolled out soon, and those numbers will be shared to the members of the public, and those appointments will be done via WhatsApp service. Thank you.
Thank you very much. CL Communications, we are ready for your follow-up question. CL Communications.
Good morning again. Are you hearing me?
Yes, we are. Please ask your question.
Okay. So basically, this is our next question again from the member of the public. If as a citizen, I got vaccinated with one vaccine that was manufactured by one manufacturer, and then I go into my second dose, can I say to this health center, I want to be vaccinated with the vaccine that came from that same manufacturer? So let's say I take the vaccine from the manufacturer that was that came from India, and I go for my second dose, and I say, well, okay, I want the vaccine to come from the manufacturer from India. Can that happen? And then secondly, picking up on Ms. Bostic's question, are you seeing people crowding the system, like making double appointments or triple appointments? Thank you.
Ms. Bash, could you take the first question?
I'll take the second question. Okay. With respect to the appointments, yes, we are seeing persons who are registering in all the different RHAs, calling as well as walk-ins. So we are seeing that. And once the reconciliations are done, and with the technology that will be rolled out very shortly from the Ministry of Health, we will be able to ensure that persons aren't double booked.
Thank you very much. Dr. Richards will take the first question that was posed.
Okay, that's a very good clinical and operational question that has been posed. And at this current time, the Ministry of Health has not had we don't have a policy decision on it per se, but we will assess on a case-by-case basis based on clear evidence from where the person would have obtained the vaccine. So, that is the sort of information that has to be really brought forward to the health centers. And of course, we continue to have a phase basis for the introduction of the vaccine. That phase basis would include phase 1, which right now includes healthcare workers and persons who are basically of high exposure, and high-risk persons, that is persons who are over the age of 60 and persons who have NCDs over the age of 60. Thank you.
Thank you very much. We now go to Newsday. Newsday? Okay.
Good morning again, Rihanna McKenzie here from Newsday. Just a quick question. I know that I've been hearing that there have been some questions about the efficacy of the vaccine coming to us from China. Given those concerns, are we still waiting for a WHO approval? Have those concerns been raised with the WHO? Thank you.
Thank you for your question, Dr. Richards.
Okay, so in Trinidad and Tobago, we rely heavily on scientific evidence that comes from the World Health Authority. At this point in time, the WHO has not given final EUL approval. We expect to get some update on them by the end of April, and so we have not decided to use this vaccine at this point in time. And this approval will come from the EUL unit and our local technical advisory group. Thank you.
Thank you very much. Ladies and gentlemen, we have come to the end of the question and answer segment. The Ministry of Health thanks you for joining us for today's media conference. Remember that even though we continue to have high uptake of the COVID-19 vaccine, everyone must continue to follow the health guidelines. It's as simple as 3 W's. Wash your hands, watch your distance from others, and wear your mask. Thank you. Enjoy the rest of the day. We leave you with a very informative video produced by the BBC on COVID-19 vaccines.
If you haven't already had a coronavirus vaccine, it's likely you'll be offered one at some point. For many people, this can't come soon enough, but others may feel wary about having a new vaccine in case it makes them feel unwell. First, let's look at how some of them work to see why they can't give you COVID. mRNA vaccines use a tiny piece of the virus's genetic code, called messenger RNA. This is how Pfizer-BioNTech and Moderna's vaccines are made. Viral vector vaccines carry DNA that contains a piece of the coronavirus genome. This has been put into a less harmful virus that's been weakened so it can't make you ill. It's how the Oxford AstraZeneca vaccine is made. The DNA, or mRNA, work by instructing your cells to make lots of tiny spike proteins. These are usually found on the surface of coronavirus, but they're harmless on their own, which is why you can't catch COVID from these vaccines. But the spike proteins are enough to make your body think it's been infected, which gives it the information it needs to protect against future attacks. Other vaccines contain parts of coronavirus, and some, like CoronaVac and Covaxin, contain the whole virus. This is inactivated, so it cannot cause infection. It's normal for people to suffer mild symptoms after being vaccinated, such as a headache or a raised temperature. This is not the disease itself, but the body responding well to the vaccine. It shows you're having an immune response. Millions of people have already had a vaccine, and very few have reported severe side effects, like an allergic reaction. But, as with most medicines, there is always a risk. Because of this, there are groups of people who may be advised against vaccination in case it makes them unwell. Those who are allergic to a specific ingredient, for example, should be offered an alternative vaccine. Advice varies between countries and should be available on your government website or through your doctor. Scientists around the world have been working hard to ensure the safety of coronavirus vaccines. And as more people are vaccinated against COVID, we should be able to gradually return to our normal daily lives.
Hi guys, how is life under lockdown? Are you getting used to it? Are you bored, lonely, feeling low? If the loss of your normal life is hitting you, know that you are not alone. Here are 5 simple ways that'll help you take care of your mental health in these uncertain times. If you are anxious, know that it's okay. Your anxiety is completely normal. It can actually help you make the kind of decisions you need to be making right now, like washing your hands frequently for 20 seconds, not touching your face, and not gathering in large groups. Avoid information overload. The constant stream of information can cause stress. Don't check the news repeatedly. Try blocking time once a day when you check the news. Maybe disable the notifications on your apps. Limit the amount of information you consume. Question what you read on social media. There are a lot of rumors online that make you panic. Seek out the facts rather than focusing on the what-ifs. Use only trusted sources of information like the World Health Organization and UNICEF. Focus on yourself. Watch a movie, read a book, get some exercise, learn something new, a musical instrument or a dance maybe. Staying physically active is very important. Use this newfound time to do things that you've always wanted to do. While maintaining physical distance is absolutely essential to prevent the spread of